Welcome to Living Well with Sigma Humans, a conversation about preventive care, thoughtful living, and how healthcare can better support the way we actually live. On this podcast, we delve into what it means to adopt a proactive, relationship-driven approach to health, particularly at a time when many people feel overwhelmed by the healthcare system. Today, we're talking about access, prevention, and why so many people on Chicago's North Shore are looking for care without the waiting rooms. If you live on the North Shore, access to healthcare probably looks reassuring at first glance. There are respected hospital systems, well-known specialists, and no shortage of medical offices. On paper, it seems like care should be easy to access and straightforward to navigate. But for many people, the lived experience feels very different. Scheduling a primary care appointment often means waiting weeks or even months. When the visit finally happens, it can feel rushed, focused narrowly on the issue of the day, with little time left to talk about prevention, long-term health goals, or how daily life actually affects well-being. Over time, people begin to accept this as normal, even though it leaves many feeling unsupported and disconnected from their own healthcare. This gap between what healthcare promises and how it actually feels is at the heart of why preventive care has become so difficult to maintain. Most people don't avoid preventive care because they don't value it. They avoid it because the system makes it inconvenient, impersonal, and hard to engage with unless something is already wrong. Traditional primary care practices are under enormous pressure. Physicians often manage large patient panels, appointment slots are tightly packed, and administrative demands continue to grow. In that environment, care naturally becomes reactive. The focus shifts toward addressing immediate problems rather than building relationships or planning ahead. Preventive care, however, was never meant to be transactional. At its core, it is about understanding a person over time. It is about having space to talk through lifestyle, stress, sleep, nutrition, family history, and early signals that might otherwise be overlooked. It depends on continuity and trust, both of which require time and access. When preventive care is done well, it feels very different. Visits are unhurried, conversations are thoughtful, follow-up is consistent, patients feel known, not processed. Health becomes something that is managed intentionally rather than something that is addressed only when symptoms demand attention. Across the North Shore, more individuals, couples, and families are beginning to look for this kind of experience. They are not rejecting traditional medicine or the value of insurance. Instead, they are searching for a model of care that works alongside the existing system while addressing its most common frustrations. This is where membership-based care enters the conversation. Membership-based care, sometimes referred to as concierge or direct primary care, is built around a simple idea: fewer patients, clearer access, and stronger relationships. By limiting patient panels, providers are able to spend more time with each individual, offer easier communication between visits, and focus on prevention rather than volume. For patients, this often translates into longer visits, direct access to their care team, and a clearer sense of continuity. Instead of navigating a rotating set of providers, patients develop an ongoing relationship with people who know their history, priorities, and goals. Another important shift in this model is where care happens. In-home visits and telehealth are not treated as secondary options, but as integral parts of care delivery. Home visits allow providers to meet patients in their own environments, where conversations are often more relaxed and observations more meaningful. Telehealth, when used thoughtfully, allows for follow-up, questions, and preventive guidance without unnecessary delays or disruptions. This approach does not replace in-person medicine or specialized care when needed. Rather, it fills the gaps that so often exist between appointments and across different parts of the healthcare system. It creates continuity, where fragmentation has become the norm. Sigma Humans was built with this understanding in mind. The focus is on preventive, relationship-driven care that respects how people actually live. By combining in-home visits, thoughtful telehealth, and ongoing support, Sigma Humans offers a model designed to reduce friction and restore a sense of calm to healthcare. This model works particularly well for North Shore residents who value privacy, time, and proactive planning. It supports individuals managing chronic conditions, couples coordinating care together, professionals with demanding schedules, and adults caring for aging parents. In each case, the goal is the same: to make healthcare more accessible, more personal, and more sustainable over time. Healthcare does not have to feel overwhelming or chaotic. It can be steady, it can be preventive, and it can be built around relationships rather than waiting rooms. For those on Chicago's North Shore who are looking for a different way to engage with their health, care without the chaos is not an abstract idea. It is already taking shape. Thank you for listening to Living Well with Sigma Humans. We appreciate you spending this time with us, and we look forward to continuing the conversation about preventive care, access, and living well. See you next time.